The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees. Now, time for a break with Central Illinois' own Gretchen Wirtz.
Welcome back to Central Illinois Newsday. I'm Gretchen Wirtz, and joining us today is someone here to talk about headaches. And I know we've all had them. We've all experienced them,
For sure.
but there is a lot out there to know about them. And joining us today, Kimberly Lopez, nurse practitioner with Bond Eye Associates, is going to be talking with us a little bit about headaches. Now, I was surprised and confused to see a nurse practitioner with an eye and then all this, but there is definitely a correlation here, and it's something that really needs to be looked at. Tell us a little bit about what you're doing for Bond Eye.
Okay, so I've been with Bond Eye for a few months now. I came from the pain management field where I did treat headache disorders. So when I went with Bond Eye, we were able to correlate eyes with headaches. A lot of times primary cares or patients will be referred to Bond Eye for headaches, thinking something's wrong with their eyes.
Right.
So when the doctors look in their eyes and they're like, your vision's good, this is something else. This is the component where I come in to kind of try to help with what's causing the headache if it's not the eyes.
Okay, so how do you know? What do you do, or how do you break it down and when they come in?
So what we do, a typical, is we have a patient fill out like a history, medical history that they'll bring with them, and almost like a headache diary too.
Okay.
Okay, because we need to know kind of what triggers a headache.
Right.
There's so many different
patterns,
types of headaches out there. So we have to kind of narrow it down to see what kind they're experiencing.
Okay.
So they fill out a packet, just a bunch of questions. Then they'll come in, they'll see me, I'll go over the packet, go over their signs and symptoms, kind of do an intake flow, and then see where we're at with what they've done. A lot of times when people come to me, especially when I was in the pain, they've already had these headaches or migraines for a very long time.
Yes.
So a lot of times I'm just reworking maybe what they've been doing, adding something else on to kind of help if they're not having a reduction in their migraine.
Okay.
Now, also I can, diagnose migraines as well, or whatever headache it is, and we can start from fresh. So I can do from start and go, or I can go from people that have had headaches for 20 years, and we can kind of revisit that and see.
Okay.
And then basically it's just managing their headache, trying to reduce the intensity, trying to reduce the frequency, because headaches in general can be very debilitating. Okay. There's studies out there. I'm a member of the American Headache Association that show that over 3 billion people in the world have headaches, 38 million in the US alone, and they're not being treated. And there's billions of dollars wasted every year, people from missing work.
Yes.
And so then productivity is down.
Yeah.
People not having a quality life to go to their, son or daughter's games or whatever.
Yeah.
So it's really trying to manage that so people can take their life back.
And a migraine is different than a regular headache.
A migraine, yes. So there's 3 types of what we call primary headaches. Okay. Tension, which is the most common, about 60 to 70% of people have a tension headache. That's presents more with like a band around the head, kind of squeezing in, kind of tends to start from the back and come up. Okay. There's the migraine, the traditional migraine. That's presents more one-sided or unilateral, to where it's one side of the head. It can present both ways, but that's where you're sensitive to light or you're sensitive to sound. You have nausea, you can have vomiting.
Lasting a long time.
Lasting 4 hours to 3 or 4 days or more. So that's where you get the debilitating aspect of a headache.
Okay. And real quick, the third type
is a cluster headache. So clusters are very, they're not around as much. That is where that's more ocular actually.
Okay.
It sits right behind the eye. Tends to come up more in men than women, and it's something that typically happens the same time every day, same spot. Last about 60 to 90 minutes on average.
Okay, this is all very fascinating, and I hope you come back because I've got so many more questions here, but I had no idea, and this is great that Bond Eye has you there to help with this issue because, this is definitely, it correlates, and it's great. So check them out, bondeye.com. You can check out their locations, Bond Eye Associates in Peoria and Pekin. Cindy, thank you so much for Kimberly, sorry. Thank you so much
okay.
for being here because,
Thank
that
you.
was some great information,
Yes.
very helpful, and I'm
Yes.
glad you're with them. Thank you so much.
Thank you, Gretchen.
All right, we got more coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.